Now, we've been hearing about checkpoint inhibition in solid tumours. We've heard a lot here at ASH. Nivolumab, the presentation of Dr. Armand. What did we see and what are the implications here of looking at the PD-1 pathway and using it therapeutically?
I think in Hodgkin's lymphoma in particular, which is traditionally a tumour which we know is responsive to the immune system. Here you can see that in a tumour which uses many strategies to overcome the immune attack, that if you take away one of the strategies, which is in this case PD-1 expression on the tumour cells, and Dr. Armand very elegantly showed that these patients did have upregulation of PD-1 on the tumour cells. And when you relieve that blockade, suddenly the immune system now is able to do its job and target and kill these cancer cells.
How impressed were you with the results in these refractory and relapsing patients?
I mean, the responses are incredible when you see over 80% responses in patients who had a third of patients had over 6 lines of therapy. So these are very heavily pre-treated patients. So this, with a single agent therapeutic, is an incredibly impressive response.
Does it deserve, as Dr. Armand seemed to be suggesting, breakthrough status? I know the FDA is considering this.
So I think absolutely, and I think the next question will be, you know, what do you combine it with? Do you combine it with chemotherapy, or do you combine it with other immunotherapeutic strategies such as targeting CD30, such as you know, looking at other ways to overcome the immune evasion with like CTLA-4 blockades, etc.
And still with Hodgkin's disease, a PD-1 blockade with pembrolizumab. That's another similar agent to the one that Dr. Armand was talking about, but Craig Moskowitz was giving us some fairly impressing, he called it compelling data. What do you make of this? This was in Hodgkin's lymphoma.
Yes, and so actually both centres were involved with both PD-1 blockers, and I think honestly the responses are very comparable in both studies. One, it says 66% responses, other was 80%, but you know, with low numbers, and these are, as I said, very heavily pre-treated patients. So again, I think it's still extremely impressive, and I really look forward to the advanced stage, you know, phase studies for these agents in Hodgkin's lymphoma.
So it really looks as if this PD-1 blockade is re-enabling the ineffective immune infiltrating cells then, is it?
Correct. Re-enabling them, yes.
What do you think doctors should take home from those two papers then?
So I think what they should take home is that ultimately there are a lot of very exciting therapies out there for Hodgkin's lymphoma now. We are seeing more and more how the immune system is incredibly important for controlling this disease, and ultimately I think what we as physician scientists need to be working on is how can we transform the therapies for these patients to remove chemotherapy and to just, you know, focus on overcoming tumor immune evasion as a way to treat this disease.